The 100 patient project is a project I am quite excited about. The approach involves a three-way collaboration with an advocacy group called Genetic Alliance. The Genetic Alliance was founded in the mid-90s by a fiercely impressive and amazing rare disease mother named Sharon Terry. And it has become an umbrella organization for multiple different rare diseases. They have just an impressive history of advocacy and also developing ability and technology to help drive development of therapeutics. They have recently partnered with an organization called Luna. Luna is a public benefit corporation, and their focus is to drive development of improved therapeutics and medical delivery through patient-driven participation. So you can join Luna and upload or link your medical record and your medical history. You can fill out surveys and become a partner in developing a better understanding for diseases, lifestyles. There are a number of surveys you can participate in. And the other thing I really value about Luna is you can withdraw at any time. So it is entirely dependent on your input. You own the information you give them. And if you decide you don't approve of the way it is being used in one study, you don't have to participate. If you decide you would like to withdraw your data completely, you have that power. So it puts patients in complete control, which is something I think is really important as a matter of transparency and a matter of privacy. They subscribe to the highest level of privacy for medical records that you can find anywhere in the world. It's compliant with recent legislation in California and also compliant with European Union regulations. So it's a really great platform from that standpoint. So this collaboration involves Luna and Genetic Alliance and the MPS Society. Something I forgot to mention about Luna is that it was founded by individuals who had been at a genomic sequencing company called Illumina, which is a leader in the field of genome sequence. And it was founded by individuals who wanted to develop a patient-driven platform that could improve medical care delivery. So this project involves getting whole genome sequence from 100 Hunter patient volunteers. Hunter disease, MPS II, is a disorder in its most severe form, which is about 2/3 of our patients, unfortunately, has both somatic disease involving heart, skeletal issues, and other diseases of major organs, as well as neuropathic disease, cognitive decline. One of the things that I think is exciting about this is that individuals with Hunter obviously have serious disease, but there may be interactions with other alleles in their genome that could profoundly impact how Hunter presents or how Hunter looks when it's treated. So we're now moving into a landscape where Hunter patients are being treated with conventional enzyme replacement therapy, or maybe they're going to be treated with one of these new AAV therapeutics or one of these new blood-brain barrier crossing ERTs. How is their disease going to look in a treated form? And what kinds of other alleles or polymorphisms in their genome could influence their treated disease? Being able to use whole genome sequence is a wonderful tool. So what we will do with the 100 patient project is identify 100 patients who have their medical records linked with the Luna platform. Luna will take all of their data and completely anonymize it. So any researcher looking at it has no idea who it came from or any of the identifying information associated with it. 100 of the patients who get their medical records linked will be selected for a whole genome sequence. And that whole genome sequence will be melded into this research data set. So researchers can compare rare polymorphisms or maybe specific mutations that cause Hunter with the medical records of the patients. This could improve diagnostics. This could improve identification of patients who have more atypical forms of the disease. This could identify ahead of schedule, so to speak, rare phenotypes or presentations of individuals who have treated disease. So I think it's a really exciting project. And to my knowledge, there has been no other rare disease that has pursued quite this approach in quite this way. So I think it's very exciting times ahead with that project.